Hey everybody, welcome back to another episode of RN Cliff Notes. Today we want to dive deeper into the endocrine system, right? And we want to talk about hyperparathyroidism versus hypoparathyroidism. This system can be very elusive unless you have the ins and outs, right? So we're going to give that to you in this episode. All right, so what are we doing at RN Cliff Notes? We are helping students to see through larger concepts. How do we do that? By giving you study smart strategies, right? So it's not enough to listen to a lecture, watch a PowerPoint. It can't be that plain. You gotta get that study smart strategy so it sticks in your mind, right? Okie dokie. So we're numbering our paper or our device from 1 through 5 this time, okay? And jumping right in. Okay, so if you watched the previous video, we're reflecting on our endocrine system anatomy, and we want to provide a number sequence for the following structures in the endocrine system, okay? So remember that anatomy picture we have. We're going to bring that back, but we want you to identify a number code, and you're going to identify these in order: the adrenal glands, the thymus, and the pancreas. So those three numbers that correspond to those structures, okay? All right, so here comes that picture. There we go. Again, identify each of the following: adrenal, thymus, and pancreas. Okay, pause if you need to. And the code you should have come up with is 945. Structures 945. 9 would be the adrenal, 4 would be the thymus, not to be confused with the thyroid, right? And then the pancreas would be 5. So when we isolate those, all right, so we've got 4, thymus. Remember we said that's behind the breastbone or the sternum, okay? 5, the pancreas, going transverse there in the abdomen. And then the adrenals on top of the kidneys, right? All right, good, you're getting the hang of this. So, going a little further. Now, for numbers 2 and 3, we want you to identify what 2 hormones regulate calcium serum levels, right? What 2 hormones do that? So jot those down as 2 and 3. Okay, and you should come up with the following: calcitonin and PTH. Now, that PTH stands for parathyroid hormone, or PTH, right? So we're going to use that abbreviation. So calcitonin versus PTH. Now, the next part. Okay, so we want you to realize that parathyroid hormone takes calcium from the bone and moves it into the bloodstream. Now, for some of you, that may be new news, right? So your bones actually act as like a storage area for calcium, and your body can borrow from that. Think of, let's see, how about we take the scenario of the Naked and Afraid show, right? So you've got people, what, 20 some odd days. They aren't going to drink any milk. They aren't going to have any yogurt, right? Cheese, anything like that. But muscles in their body, such as their heart, those muscles still need to move and function appropriately, and that's going to take a certain level of calcium to be able to achieve that. So for the duration that they're on their show, their body is borrowing some of that calcium from their bones. So if we were to measure their PTH level, it would probably be significantly high for folks like that. They're needing to borrow calcium from their bones on a regular basis. All right? Good. So parathyroid hormone. Another way to look at it is this. When we have a paralyzed individual, we expect that paralyzed individual, right, to at some point have weakened bones. And we just want to kind of make an association with that. So their bones are weaker, right, because they're what? Paralyzed. They're not actually using the bones. So it's sort of a play on words. That person's paralyzed, they have weaker bones. Paralyzed, parathyroid hormone makes the bone what? Weaker in terms of its calcium structure, right? is calcification. Okay? Good. Parathyroid hormone weakens the bone in terms of calcium and sends the calcium into the blood. Yes? All right. So now, next, calcitonin. Calcitonin is its opposer, right? So together, they wind up achieving homeostasis, that balance that we want in the bloodstream in terms of our calcium level. So PTH, what? Sending the calcium to the blood, and the calcitonin sending calcium from blood into the bone. So it what? Tones the bones. Tones up the bones. So you want to catch that. So they work opposite each other. Good. Okie doke. So now we're going to go a little deeper, and I like to set this up whenever we're talking about endocrine, so you get to see a chart basis of what's actually taking place. So parathyroid hormone, if it's too high of a level, you wind up in hyperparathyroidism, right? Or if your parathyroid level is too low, it's hypoparathyroidism, right? But now, here comes the next question. If you have an individual with hyperparathyroidism, now, what is that going to do in terms of the calcium level in the blood? Would it be hypocalcemia, or would it be hypercalcemia, or would it remain unchanged? So write that down. All right. So let's see, we did 2 and 3. This would be number 4. Let's make this 4 and 5. So what do we expect in terms of a change in terms of the serum calcium level up here? 4. What do we expect in terms of a serum calcium level here? That'll be 5. So 4 and 5. What changes, if any? Okay? All right. Let's see what happens. Okay? So we got our 4, we got our 5, and here's what you should have. And this part makes it easier, right? Kind of easy to remember, because with hyperparathyroidism, you actually wind up with the patient with what? Hypercalcemia. And with hypoparathyroidism, they wind up with hypocalcemia. So don't forget that we said PTH, or parathyroid hormone. What did it do? It took calcium from the bone, weakened the bone in terms of calcium, and sent it out into the bloodstream. So the more active that is, if that's hyperactive, what happens? Then they wind up with hypercalcemia. Right. But the other way is true. If it's underperforming, then they wind up with hypocalcemia. Now, there's a few things we need to talk about when it comes to that. Okay? Now, for hyperparathyroidism, remember, if it's hyperparathyroidism, what happened? That calcium, a lot of calcium left the bones. Now, let's see what happens in terms of signs and symptoms. So, that person will wind up with bone and joint pain. Why? Calcium's leaving out, right? Then their bones easily fracture, or they suffer from osteoporosis, right? And kidney stones. Now, make sure that registers in your mind. Kidney stones. If we have excessively high levels of calcium floating around in your blood, all right? And it's your kidney's job to what? Filter and cleanse the blood. So your kidneys wind up having to catch all of that calcium, and then that calcium wants to turn into a stone inside your kidneys, right? Or in that proximity. So yeah, that's what's happening when a person has kidney stones. By the way, it's very important that if you take any supplementation of calcium, that you also take it with vitamin D. You see, some people will go and buy a calcium supplement that doesn't have vitamin D, or they don't take any additional vitamin D, and that could be a huge mistake, because that calcium will just wind up in your bloodstream and not necessarily go into your bones as it should. Vitamin D acts like an inviter. It invites calcium into your bone. That's what you want. So the best kinds of supplements to get, honestly, is if you have vitamin D blended with the calcium. You want to take those at the same time, right? Yeah. Okay. So anyway, kidney stones. Then check out that other piece, excessive urination. Now this is where I teach my students about the wisdom of the body. When a person has excessive urination, it's not just, oh, you know, it's some kind of phase I'm going through. No, your body is actually quite wise. And why is it initiating this excessive urination? It wants to lower that calcium level as well and try to urinate out as much calcium as possible. So yeah, your body's taking care of you in ways you don't even realize, right? All right, abdominal pain. The person tires easily, or they experience weakness. Now, don't forget that we said earlier that your muscles also depend on calcium to function, right? So if the calcium, instead of being in your muscles, the calcium's in your bloodstream, what happens? Then your muscles might experience weakness. Now, prepare your mind for this last symptom when we talk about depression or forgetfulness. Okay. All right, now, we talked about electrolyte man in a previous video. Now, one of the electrolytes had a significant role when it came to brain function. And that electrolyte was, what was it again? Sodium. Yes, good. So electrolyte man had a crown of sodium. By the way, that sodium had what kind of charge? It had a positive or negative charge? A positive charge. Good. Well now, hold on to that. Sodium is a cation, right? With a positive charge. Well, so is calcium. And by the way, calcium has twice the charge that sodium does. So here it comes. If you have a person's bloodstream, right, saturated with calcium, too much of that cation, it may beat out the sodium to receptor sites. Okay. Yeah, let's maybe slow that down a little bit. All right? Because what we're talking about here is the potential for a cation shift where you've got calcium beating sodium to receptor sites. And we know that sodium is necessary for brain function. Whoa, right? So then what happens with those high levels of calcium? Now this person is experiencing mental types of changes, forgetfulness and depression. Right, okay. So now, we just want to take a closer look at that individual picture that was next to our descriptions. And I want you to notice the obvious deformity, right? So that was the young man before, but with time, with his hypoparathyroidism, look at what happened to his arm, his bones, his facial structure, and things like that change, right? Yeah. Okay. So, all right, now, we want to take a look at hypoparathyroidism. All right, so this time, the symptoms, we have paresthesia, which is just numbness and tingling, right? So paresthesia of the fingertips, toes, and lips. All right, so numbness and tingling, fingertips, toes, and lips. Muscle cramps in the legs and feet. Twitching or spasms of the muscle. And by the way, that twitching, we gave that twitching a special name, and this picture was featured in the video where we're talking about electrolytes and how they work, part 2. Okay? Where the person was suffering from, what do we call that symptom? Twitching of the muscle in the arm. After we started to pump up the blood pressure cuff. We would call that Trousseau's. Hey, look, you're on your game. Okay, true souls, yes, yes. So we put that cuff on them, and what happens? They start to have a twitching sensation in their muscles, right? Yeah, true souls. Now, so spasms of the muscle, it can be around the mouth and the arms, like we got featured there, and the hands. Now, of note, could also have twitching in the throat, right? This could be bad, okay? Then fatigue and weakness, obviously. But now, okay, so in another video, and that video was titled, The Most Disturbing Cardiac Dysrhythmia. And I said we would come back to that point. So here's where we want to come back to that point. Now, if you remember, we talked about the unfortunate circumstance. I mean, it's kind of devastating situation, but unfortunate the way that it happened. But we want to understand the mechanics behind what happened so that it doesn't happen to anybody else, right? So here's what's going on. If you've got a physician giving you medication orders, it's very important for professional nurses and other healthcare professionals, especially nurses though, don't get caught up. Don't get caught up in being a medication robot, right? The doctor gave you an order to give medication and you just respond, right? You know what I mean? Another 50 mics of fentanyl, yes sir, yes ma'am. Like, no. Sometimes you might need to question that order. And that particular case was one of those times. Now let's think back. As we were talking in that video, we said that patient, it seemed that the patient wouldn't stop moving. So the doctor was requesting more medication to get the patient to stop moving. But if you remember, what did I say in that video? That patient was what? Her body was full of fluid, just waterlogged with fluid. Okay, now, let's pause there. If she's waterlogged with fluid, then by dilution, her serum calcium level is going to go low. And with a low serum calcium level due to all of the fluid being on her body, what do we anticipate happening? The twitching. That twitching type of motion. And that's not something that she can control. She's twitching because she's suffering from hypocalcemia by dilution, right? All of the fluid on her body, okay, in her system. And so at what point will she stop twitching, right? What level of medication? Right, fatal doses, okay? And that's where you have a conversation with the doctor. You know, you pull them aside professionally. It's like, excuse me, doctor, right? I want to comply with your order, but, right? If we look at all the fluid in her body, and if we look at her calcium level, right? Maybe this is tetany that we're observing, okay? Right? So, keep your thinking cap on. And it's not your job to just follow through on orders. Sometimes you need to question those orders. That's part of your role. Okay? All right, good. So, moving on. All right, now, just to zero in on some of those symptoms again. But, so we blew up the true souls, right? But then, here's the other one that shows up on tests all the time, right? Chvastics, right? Or chopsticks. So, CH. We remember this CH, right? And where is it happening? In their cheek. But the other thing that's very much testable is how to elicit the response, right? I want to take that away. So when it comes to that one, right? You elicit the response by tapping the patient in front of their ear, anterior to their ear. When you tap that area, they're going to start twitching. You're stimulating that nerve there. And they'll twitch on that side that you're tapping. Right? Now, when it came to true souls, we said it was the tightening of the blood pressure cuff that caused true souls. Right? Awesome. Okay. Well, good job, guys. Thank you for tuning in. Especially thank you for subscribing and liking. Thank you so much. We appreciate you guys. All right? Thank you, note takers. We'll see you next time.